morning. My name is Taylor Robinson. I'm a nursing student at Meridian Community College, and I'm going to be doing a physical assessment on you today. How are you feeling?
Good.
Good. All right, now I'm going to perform hand hygiene and clean my stethoscope and put on gloves. Are you experiencing any pain today?
No.
Okay, good. So on a scale of 1 to 10, how would you rate it? Okay. I'm just going to raise the bed so it's at my waist level. All right. And can you state your name and your date of birth for me?
Katie Bowman, 5/10/2000.
All right. Perfect. Can you tell me where you're at?
I'm at Meridian Community College.
All right. And what's today's date, including the year?
October 2nd, 2018.
Perfect. All right. Now I'm going to dim the lights and check her pupils, make sure they're reactive and equal. All right, so if you'll just pick a spot on the wall, and I'm going to shine this light. All right, and they're reactive and equal. All right, I'm going to check her mucous membranes, make sure they're moist and pink. So if you'll open your mouth for me. And in your nose. All right, perfect. All right. Whenever I was asking her questions, I made sure her speech was smooth and clear, and it was. All right, and now I'm going to check her upper extremities. First, I'm going to make sure the skin is dry and warm, and it is. Now I'm going to assess her upper strength. So if you will squeeze my fingers for me. Alright, if you'll pull my hands. Alright, and if you'll push. Perfect. Alright. Now I'm going to check her skin tone. I can either do it on her chest or on her hand, but I'm going to do it on her hand. Alright, and there was no tinning, so it was normal. Now I'm going to check her capillary refills. Make sure it returns in less than 3 seconds. And it did. So now I'm going to listen to her heart sounds. So, and this has to be stethoscope to skin. So I am going to ask you to lower your gown a little bit. All right, I'm going to listen to the aortic valve and the pulmonic. And the tricuspid, and the mitral. Alright. Now I'm going to listen to your lung sound, so if you'll just take in a deep breath and then exhale. Alright, so in and out. In and out. In. Now I'm going to listen to your lung sounds up on your arms. So again, just take a deep breath in and exhale. Right, so in and out. In and out. Right, in and out. In and out. Alright, and if you'll just lean forward for me, I'm going to listen to your lung sounds on the back. Alright, and just take a deep breath in and exhale. Alright, in and out. In and out. In and out. In and out. Alright, now I'm going to move to your abdomen. So I'm just going to look at it first, make sure it's not extended, and then I'm going to auscultate it and then palpate it. So I'm just going to lower the covers a little bit. Alright, and I don't see any signs of it being extended. Alright, so now I'm going to auscultate it, listen to each of the regions for a full minute, and then palpate afterwards. Okay, right upper, left upper, left lower, right lower. Alright, now I'm going to palpate it and tell me if you have any tenderness or if it hurts or anything.
Nope, I'm good.
Perfect. Alright, now I'm going to move down to her, before that I'm going to, when was the last time you had a bowel movement?
10 days ago.
Alright, and when was the last time you urinated?
About 2 hours ago.
Okay, and what color was it?
Yellow.
Okay. Alright, now I'm going to move down to her lower extremities. Whenever I'm doing this, I'm going to check her calves, make sure there's no edema or swelling, make sure they're equal. And while I'm doing this, I'm assessing if it's warm and dry, and it is. And now I'm going to listen to her pulses. So I'm going to check the popliteal first. They're equal. Going to listen to the anterior tibial. Then the dorsalis pedis. They're equal. Alright, now I'm going to check capillary refill. Alright, and they returned in less than 3 seconds, so they're good. Alright, now I'm going to assess the strength. So if you'll press on my hands, alright, if you'll pull, and if you'll bend your knees. Alright, did that hurt bending your knees or anything? Alright. Now I'm going to turn her on her side and check for lesions on her back and her buttocks. Everything's normal. Alright. And are you comfortable? Alright. So on a scale of 0 to 10, how much pain are you in?
0.
Perfect. Alright, I'm just going to raise your bed rails and lower you down so the bed's at the lowest position. Alright, and your call bell's right here.
Okay.
And the side rails are up. And are you comfortable? Alright. And make sure the wheels are locked. And they are. And that completes our physical assessment.